So I just wanted to ask a couple questions, just like generally about your goals coming here, what you thought of the mission so far. You know, you've been here for 2 years, things like how your impression has been from last year to this year. So maybe we can just start first with what were your goals for coming to Vietnam?
The goals were for this mission to assess the skills of the new staff, because they have quite a new staff here at the E-Hospital. They did bring some of their staff from the other hospital, but they recruited at least half of their staff as new. So we were required to re-evaluate that and make some decisions as to how we can help them progress their program.
Okay. I probably should take a step back. Like, do you want to just kind of tell the story of how you came to CardioStart? And I kind of read about it in the article too. I was like, that's such a great story.
I could. I came to CardioStart in 1997 after reading a nursing article in a journal about a group that does heart surgery and does it with donated supplies and volunteers. The reason I decided to do it was I had gone on a mission, or gone on a cruise, and one of the places to visit was Jamaica. I went there and got off the ship and just saw the poverty, and decided I couldn't visit. I just couldn't go there unless I was going there to help. I couldn't take part in the holiday of what the people who had money and prosperity within a community that didn't. So I decided to go back on the ship and come back at a future date when I could make a difference. And so it was always in the back of my mind that I wanted to do this, but at that point in my life I was newly married and starting a family. So then later on I saw that article and started helping with supplies and volunteers, and soon I was able to go on OBGYN mission with CardioStart, and had some suggestions on how we could improve the mission, do things better, and the next thing I knew I was leading a mission, and I've been doing it ever since. So.
And then how long were you working on it within the organization before you kind of?
Since 1997, I've been with CardioStart.
Okay. And you just kind of progressively got more involved.
Yeah, and fairly quickly got more involved, and you know, I went from being a mission director to vice president, it seemed like overnight. People back home come to me and say, well, we have a lot of need back in the United States. Why don't you do this there? But our laws in the United States and the legal system really prevents us from doing much in the United States as far as heart surgery and donations go. We are restricted too much, and in addition there are other programs in the United States that are available. Here there really isn't much for free heart surgery. I mean, you may be able to get a little bit of a discount, but it's really difficult to get heart surgery if you need it and have no money. So that's where we come in. We try to help provide what we can free of charge and help those families and patients.
Or what's the difficult part? Like, you know, just meeting that girl that's not going to be, you know, having months to live, like, makes me think, gosh, you know, I mean, I suppose that's a big reason why you want to go to different countries, kind of have more impact, more.
When we see those patients that should have been helped a long time ago, and that now, because they haven't been helped, they're left to die, there's nothing we can do, those are the reasons that we want to get there sooner. We want to make an impact, make units and facilities that can help get those kids earlier in life so that they don't reach adulthood or teens without being treated for their congenital heart disease. That the sooner we get them, the better, and that's what we're all about. One of the things that sets us apart from many other charities is we don't just go in and do a massive amount of surgeries. We go in and teach the professionals to do their surgeries at a higher level. so that they can continue to provide the care for the patients and families long after we're gone. We can make an impact long after we've left. And that's what I feel is different about CardioStart.